Jing-Well points, pericardium 9. Pericardium 9 location on the most distal point of the middle finger. How to find? Find the most distal point on the tip of the middle finger and there locate the PC9. Needling, vertically 0.1 to 0.2 tune or prick to bleed. Caution, this is a painful point. For the action indication, PC9 clears heat, especially from the heart and pericardium. It strengthens collapsium, expels internal wind. For the special features, PC9 is a Jing-Well point, wood point, tonification point. PC9 is mostly used to clear heat, either in chronic conditions with mental symptoms or in acute cases of heat at the nutritive Chi level. It also extinguishes interior wind and restores consciousness and is used in acute wind stroke together with all the other well points of the hands. PC9 clears heat and restores consciousness for those having fever, loss of consciousness. It extinguishes interior wind, those having with wind stroke. It also calms the mind, those having agitation, anxiety, palpitation, or insomnia. PC9 is a Jing-Well point of the pericardium channel, and in common with many of the Jing-Well points, the terminal and most dynamic point of the channel has a powerful effect to restore consciousness. There are some particular differences, however, that distinguish PC9 from the other Jing-Well points. First, located on the middle finger, this is the most distal of all the Jing-Well points and the only one located in the center, rather than at the corner of the nail. Secondly, as a point of the pericardium channel, PC9 is especially suitable for restoring consciousness, which occurs when the spirit is dislodged from the heart. Loss of consciousness with stiffness of the tongue may occur during the course of the febrile diseases when pathogenic heat complicated with phlegm collapses into the pericardium. The affinity of PC9 for the tongue reflected in such classical indications as pain at the root of the tongue, stiffness of the tongue, and inability to speak underlines the intimate relationship that has held to exist between the pericardium and the heart. Since it is the heart which flowers into the tongue and the heart channel rather than the pericardium channel that travels to the root of the tongue. Like several points of the pericardium channel, pericardium 9 also treats injury from the summer heat characterized by fever, agitation, vomiting, diarrhea, and collapse. The pericardium primary and divergent channels traverse all three jaw, and the pericardium is exteriorly coupled with the sunjaw channel. Like many points of the pericardium channel, therefore, pericardium 9 also has a strong action on the middle jaw and is indicated for vomiting and diarrhea, epigastric pain, and sudden turmoil disorder. In the treatment of pediatric disorders, it may be used for nighttime crying in children and childhood nutritional impairment. Among other patterns, the former may be due to accumulated heat in the heart and later to heat and blockage in the middle jaw. As the tonification and wood point, Zhongchong will invigorate the meridian and regenerate the spirit. It brings movement and breaking through the stagnation where there has been depletion and stuffiness. Rushing into the middle gets the chi moving, releasing a surge of chi in the meridian. It can lift the spirit, provides more fuel and nourishment for the fire. The pericardium is the direct route to our heart center. PC9 activates this route. The mother-child connection along the Shen cycle makes this a nurturing if vigorous point. When the heart protector has been stopped, more so without hope and too beaten down to make a fresh start, this point can help prompt new beginnings, hope, and clarity about direction. As a Jing-Well point, one use of this point is to clear pathogens, wind, and heat from the pericardium. Also, a Jing-Well point, it can restore consciousness and particularly effective in doing so. Having such a direct connection to the heart and being the most distal point, it can effect a sudden change of mood as the fast-acting distal Jing-Well point. This point is mentioned for its effect on the tongue. Although it is the heart itself that opens into the tongue, the closely bound role of the heart protector is reflected in this use of the point, as well as this being the most distal point on the pathway, which gives it a strong effect on the opposite end of the meridian. The connection of pericardium and the liver, as Joyin, also means it affects the middle jaw and stagnation of qi in the chest. When the arms are raised, traditionally known as the Chinese anatomical position, this is the highest point on the body. This point brings energy from the mother to the child via the Sheng cycle. Works directly on the mental level but can lift the spirit too. For unconsciousness or fainting, cutting off the mind from the body. Consider where the hands are hot or cold. May be beneficial for uncontrollable sexual habits with lack of affection, or for people who have difficulty expressing themselves. An often used point because wood commonly has more available energy in it than fire.